Abingdon Smiles is unique in that the practice started in 1922 with my grandfather, and he practiced until 1960 when my father got out of dental school. And actually, that's the first time I went to dental school, because I was born the summer before he headed off to dental school, and we had 4 years in Richmond and then came back here and he started the practice. And as I was growing up, I watched Dad go off to work. I would go off with him when he'd see emergency patients on weekends, and just decided that that's the kind of thing I wanted to do when I got big. So I went to college and went to dental school and graduated and became a dentist. And I didn't come immediately back home because I'd signed some paperwork with the Army and went for 3 years to Germany. And Laura and I got married right before we went off to Germany and had 3 years working as a dentist there and loved it. Got very involved with surgery because they needed somebody to do the surgery in our 27-chair clinic, and I worked with an oral surgeon, and then I was the one that did the surgery in our clinic, and that gave me a lot of interest in a lot of comfort in doing surgery. And when implants came along, I decided I wanted to learn to do that. So I've been a student of implants for about the last 8 years, and have been placing them for the last 8 years, and have learned a lot and still do a lot of continuing education, because I really feel like that's the future of dentistry. When you lose a tooth, instead of having a space or having to have a bridge, you can have a replacement with an implant. And so one of the things that's unique about our practice is that it's one of the few practices in Southwest Virginia that you can lose a tooth, a front tooth, or break one off, and the same day we can take the tooth out, we can put the implant in, we can put a temporary on it, and you can walk out looking like you never lost a tooth. And I just feel like that's you can't always do that because of circumstances, but I think that's a great service for patients, and there's a lot of appreciation comes back from that. And that's the other thing we can do is for people that have dentures, that lower dentures are poor substitutes for natural teeth, and anybody that wears a denture will tell you that. But we can place implants and be able to snap the denture down, and that's another service that people seem to really enjoy, because all of a sudden they can start eating again, they can start chewing again and enjoying their food, and they smile a lot more when they're enjoying their food. And as you get older, there are not a whole lot of things that you can keep doing, but the big three all have to do with your teeth. You can speak, you can smile, and you can chew, and if you can do all those well, your quality of life is much better than if any of those are missing. So I feel like what we do really helps people health-wise as they mature, and it's something that we can do all in the practice. We don't have to send out to another surgeon or specialist.